The program is Easy Access to Healthcare for All, bringing you news and issues around the National Health Insurance Scheme. Standards and quality assurance are a set of frameworks that provide regulations to organizations to ensure that their processes, inputs, products, and services are capable of meeting the requirement of every customer. For the NHIS, giving every Nigerian access to affordable health care is not only the mission. Its mandate involves also ensuring that the delivery system is of a standard quality. What are the frameworks in place? How do they function? Those are the things we shall be finding out in this episode of Easy Access to Healthcare for All. My name is Aisha Muhammad Ahmed, your anchor. Please stay tuned. First on the program is a highlight of events around the NHIS. In our lineup, Executive Secretary of the NHIS presents 2021 budget performance before lawmakers, and NHIS media and marketing team retreats to recharge in Kaduna. Details coming up next.
Easy access to quality healthcare for all. NHIS.
As part of its pre-budget meetings, the House Committee on Health Services, led by Honorable Tanko Sonunu, invited the Executive Secretary of the NHIS, Professor Mohammed Nasir Sambu, to give details of how the 2020 and 2021 budgets of the agency performed.
I want to invite the Executive Secretary, National Health Insurance Scheme, to give us their 2021 budget performance and also to present and to defend the proposal as laid down by the President in the joint session of the National Assembly.
Responding, Professor Sambu disclosed that the agency received 144 million naira for the year 2020 and had utilized over 140 million naira, with a balance of 3.5 million which was rolled over into the 2021 budget. For the 2021, Professor Sambu said over 400 million naira has been released from the 714 million naira appropriated to the agency in the 2021 budget.
As we have received appropriation of 714 million .07. The amount released so far is 443.1 million, and we have utilized 1.3 million. And I'm sure we will be asked, why is this so? Because most of the monies that we have received in the first and second tranche were to enroll constituents, people at the level of constituents. And the process, when the first tranche was released, it was insufficient for us to do the exercise. So we have waited for the second tranche so that we can now begin to liaise with the members of the National Assembly, both the Senate and the House of Reps, and establish mutual health association in the community, enroll the members of the mutual health association, and they will begin to receive cover. And even if we go through to the end of December, you will utilize that the utilization of the money, it will not be total, because the money is going to cover the members that are registered within a period of 1 year.
After commending Professor Sambu for the great work he is doing in the NHIS, Honorable Sonunu called on members of the committee to key into the group, individuals and family social health insurance programs, so as to carry along their constituents in the drive towards universal health coverage.
And that will reduce people calling you that I'm in the hospital, provide some money, because you can tell them, are you not enrolled? So it's just 10% of it that you pay, so go and pay. A form will be given to you. Okay. If it's going to cover 2,000 people, 2,000 forms will be given to you. And you go to your own constituency, and you select the bearers. You can say only pregnant women. You can say elderly, aged, children, you understand? Or any other group that you think you want. And then they will give you the form. Once the form is given to you, you take their data, and NHIS will come and enroll them. Give them their ID card, and they will begin to enjoy the services.
Staff of the Media and Public Relations Unit of the NHIS retreated to Kaduna for a 2-day training workshop. The workshop, facilitated by Sternum Consulting, which held on the 28th and 29th of October 2021, was aimed at arming the Media and Public Relations Unit of the NHIS with the right skills and knowledge.
The idea essentially is about professionalizing NHIS. The current NHIS management being run effectively and competently by Professor M.N. Sambo is repositioning, reforming NHIS and making it as professional as a world-class organization ought to be. And this is part of it. The media team or the staff of the media unit have been sent here to have this training to professionalize them, make them more effective in the discharge of their responsibilities.
Areas covered in the training included marketing communication, engaging the press, a new paradigm, rudiments of public relations, skills in personal presentation and self-mastery, media technology and digital media production, media critiquing.
We strongly believe that after this training, we'll be more skilled, more empowered, more prepared to indeed go out there and preach the gospel according to giftship.
Attendees of the training workshop were in high spirit and looking forward to exercising all the knowledge and skills they acquired during the training.
Okay, it has really been interesting and lively for us that are in marketing. We've learned a lot from the press that we've come to join the press unit, and it has helped us to be able to strategize in how we relate with our enrollees.
They've opened our eyes to new things. For the job we have been doing, we have seen new way, new approach of doing our job. And we know by the time we leave this place, if we can put what we learned today and add to all what we already know, our job will just be perfect.
It's been very insightful, very educating, and a lot of interaction too. So I've learned so much more of what we know, and I've also learned so much about what to do with the press because
the NHIS has a mandate to give Nigerians accessible and affordable health care. The tendency for people to think that this will mean substandard care is therefore common. This is far from the fact because the NHIS has a whole department committed to seeing that enrollees get the best of care. In our next segment, Issues Around the NHIS, we shall see what this entails and how the scheme works towards ensuring that standards and quality are assured.
Easy access to quality healthcare for all. NHIS.
And whenever we come, we are in need of their help, they usually used to assist us based on their own. So we really enjoy NHIS and we can always say it is great for us.
It's very good, to be honest. I'm enjoying it. And the 10%, so many people joining the NHIS because of that 10%. You don't have to pay your medicine bills, all of it. You'll just pay 10% and that's it.
The beauty of the National Health Insurance Scheme is in the freedom enrollees have when they can go to any hospital of their choice and get attended to. This is in line with its objectives, which includes to ensure that every Nigerian has access to good healthcare services, and 2. Ensure efficiency in healthcare services. The new management of the NHIS, under the leadership of Professor Muhammad Nasser Sambo, through the agency's Department of Standards and Quality Assurance, ensures that enrollees are given the highest possible quality of healthcare services at the right price, in line with President Muhammadu Buhari's agenda on universal health coverage and the United Nations Sustainable Development Goals.
The Department of Standards and Quality Assurance, which I will call SQA, is key to the quality of services that is provided under the scheme. They are to also ensure that services are purchased at the right cost, and also at a cost that is beneficial both to the scheme, if I will put it in the layman's language, both to the scheme and also to the enrollees, in what we call strategic health purchasing.
There are various processes involved in accrediting and checking the standards and quality of healthcare facilities and health maintenance organizations. These are carried out by state offices of the NHIS.
For healthcare facilities, there are issues of registration with Corporate Affairs Commission. There are issues of registration with the state ministries of health. There are issues of also registration with the regulatory bodies. For example, if you are setting up a lab, we expect you to also register with Medical Science Lab, Medical Scientists Laboratory Science Council of Nigeria. We expect pharmacists to register with Pharmacist Councils of Nigeria and all that. We look at the personnel. So, for example, if you are running a hospital, setting minimum qualifications for personnel and number of personnel are important. So, for a regular hospital, a full hospital, you need doctors, you need nurses, and all these doctors, nurses, lab scientists, pharmacists, they must be licensed. And you also need, apart from the personnel, medical record personnel are also important. And then other staff, like administrative staff, and all that, everything to do with human resource for health are all required. And then we need also the equipment. So you are going to look at the equipment, you are going to assess how the necessary equipment. For example, if you are looking at surgery, there are particular equipments, medical equipments that are necessary for you to be accredited for surgery.
It is to boost the state office's capacity to do this that the scheme only recently employed and deployed 190 healthcare professionals to be deployed to the various state offices for more efficiency.
The issue that has to do with poor foundation of the organization is the human resource. No matter how much we try to move fast, if we don't correct that foundation, you will find it difficult. And this one that we are doing, you will now have a critical mass within the state that can be able to undertake activities very fast in terms of, if you want accreditation of your facilities, they can easily go and do. If there is a dispute between health maintenance organization and healthcare providers, they can quickly swing into action. If they have quality assurance monitoring, they can easily move from one hospital to another. And the sum total of all these interventions is what will bring sanity and what will bring effectiveness and efficiency within the national health insurance.
The NHIS, having accredited the healthcare facilities, gives enrollees the free will to register with a healthcare facility of their choice.
We don't influence the choice of facilities. So, for example, if you are enrolled under NHIS, you can decide on which healthcare facility you want to go to. And after 6 months, you can decide to also change your healthcare facility if you are not happy with the services you are getting. We are trying to also see, with the coming of eNHIS, how people can go online and change their own healthcare facility without having to bother traveling or moving around and all that. So in the next few months, that's going to be available to enrollees.
Apart from hospitals, the NHIS also has health maintenance organizations as critical partners in the implementation of the scheme. Here too, the NHIS has standards that HMOs must meet for them to participate in the scheme.
For HMOs, we have a requirement for HMOs. They must be registered with the Corporate Affairs Commission. They must set up a good office, meet all the regulatory requirements for setting it up, and then we also assess them. After they've submitted their applications, they've gone through all that, we assess them, we rate them based on governance structures, call center, personnel, and all that, and then we give accreditation to them.
Once accredited doesn't mean always accredited. The NHIS reserves a right to sanction or withdraw the accreditation of HMOs. When this new management came on board, it had cause to withdraw the accreditation of several HMOs. When reinstated, a comprehensive induction and training was organized to further acquaint them with how the NHIS operates.
In the new NHIS, a reformed NHIS, we disqualified or we remove the accreditation of those who could not fulfill the criteria, and we give them moratorium where they will wait and reapply fresh. So some of them have reapplied fresh, and they are coming into the system as if they are coming newly.
It is a welcome development, because at least we all have the 6 HMOs were here, which went through the induction. It's good that we passed through this induction. It's an eye-opener. You saw the kind of training we all had to go through before we are given the certificate. So hopefully the training is not just here. We are trained to go back and teach our core staff so that they can be able to do well in the scheme.
Ensuring standards and quality before participating in the scheme is not all there is to it. The NHIS also monitors compliance by carrying out routine checks on the healthcare facilities and health maintenance organizations. For this, the NHIS has an enforcement department.
The enforcement department has a very crucial mandate within the scheme. And what is this mandate? The mandate is to ensure that the provisions of the operational guideline and the NHIS Act are being strictly adhered to by all the stakeholders of the scheme. And this is in a drive that is for the scheme, in a drive for the scheme that is to attain its own objectives.
The NHIS enrollee is described as the king or queen of the scheme. Everything is being done by the regulatory body to see that he gets quality care whenever he or she needs it.
Welcome back from that timeout. Easy access to healthcare continues with our stakeholders segment. In this episode, we are looking at Barrow Dikko Teaching Hospital, which is located in the heart of Kaduna Metropolis. The healthcare facility caters to over 6,000 NHIS enrollees, offering primary, secondary, and tertiary medical services. We chatted with Dr. Ramatu Abubakar, HOD, Family Medicine and Coordinator of NHIS Unit at the Barrow Dikko Teaching Hospital, Kaduna. As a stakeholder, she speaks on some of the benefit of being an enrollee of the NHIS.
When NHIS patient comes, the NHIS patient doesn't pay for registration like regular patient. Regular patient pays 500 when the patient is new patient and also pays 200 when it's a follow-up patient. But NHIS patient doesn't pay such fee. And another thing is that in terms of booking, for example, if a patient, NHIS patients want to see a specialist, if you are referring NHIS patient to see a specialist, the booking period is usually lesser compared to, because we give priority, we give different books, one for regular and one for NHIS patient. So we give the priority for NHIS patient. And also there is what we call co-payment. When patients, NHIS patient wants to get his or her own drugs at the point of service, that's at the pharmacy, he only pays the 10% of the drug dispensed per prescription. Meanwhile, the regular patient pays the total costs of the drugs.
Dr. Ramatu also shares with us some challenges hospitals face with some NHIS enrollees.
What we observe and then what we have been facing with NHIS enrollees are, number one, they tend to claim rights. They are always on the right, that they always want to tell you that it's their money they are contributing, that they contribute money, so it's their rights to get access to health. Not knowing that this is based on the principle of solidarity. The well subsidize for the poor. The healthy subsidize for the sick. So they are not aware that there's the principle. Maybe they need to be enlightened about this. So apart from that, most of them are public workers, so they are civil servants, so they come at any time they want. And another challenge is that some of them tend to abuse the system. For example, they will give their ID card or they will just invite someone outside the beneficiary to come and assess. They give their ID card. So if care is not taken, if the logistic is not been done, if the protocol is not duly followed, we end up losing. So these are some of the challenges that we face with the enrollees.
In closing, Dr. Ramatu has this advice for those who are yet to register as enrollees of the NHIS.
I will advise these people to find among the programs of NHIS to get enrolled into, even if it is not the formal program, which is usually the formal sector that we are operating. There are other programs of NHIS. They should try and get enrolled to protect them from huge bills, huge medical bills. That is the catastrophe of these bills. There are other options like community-based social health insurance they can get involved in, which is usually all about the cohesive group of people. It can be occupational base or household base or family base, anyone of that nature. And there's also another option, which is the gifts, group, individual, family, social health insurance, which emanated from the BC ship, which we call voluntary contributor social health insurance program. It is good. Even if it is as an individual, one can get enrolled. As family, the members can get enrolled through this program, as well as a group. That is in a company or in an organization of less than 10 individuals. They can also get involved. So nobody will be left behind.
That was Dr. Ramatu Abubakar, HOD Family Medicine and Coordinator of NHIS Unit at the Barrow Dikko Teaching Hospital, Kaduna. We will now take your questions in our last segment of the program.
Where do I register? How can I get enrolled? Where do I register?
How can I get enrolled?
How can I get enrolled?
Question: what are the contribution sets for the informal and formal sectors?
The contribution sets for the informal sector, the main contribution set is what we call the Basic Healthcare Provision Fund, which is an intervention program by the federal government. 1% of the consolidated revenue from that has been given to states to cover their vulnerables, and the state will obviously give counterpart funding so that the program is actually sustainable. So the government pays its own part, and the states that are part of this will give their counterpart funding so that they can actually cover their vulnerables. For the formal sector, formal sector is largely contributory. In the federal government formal sector, which is our major formal sector program, we have about 3 categories. So we have those that are paid on behalf of federal government because they are treasury funded. So the federal government deducts the health insurance component from their salaries at source and then disperses those funds to the scheme, and we then cover those people once they're registered.
Where do I register? How can I get enrolled? Where do I register? How can I get enrolled? How can I get enrolled?
That's our package for the week. We have discussed how the NHIS doesn't leave anything to chance in ensuring that quality healthcare is delivered to enrollees. It is a system that serves every one of us. Let's do our part to protect it. See you next week.